Good morning, everyone, and welcome to the OpenWorks webcast on how to combat and control COVID-19, cleaning versus disinfecting. Just a quick housekeeping announcement for everyone. A link to the recorded webcast along with a PDF to the slide presentation will be emailed to you in the next couple of days. So please keep a lookout for it in your inbox. I'd like to introduce you to our expert presenters this morning. Whoops, sorry about that. We have a bit of a delay. There we go, my apologies. Our experts today are Liz Caracciolo, our Chief Operating Officer at OpenWorks, who is a nationwide provider of commercial cleaning, disinfecting, and facilities services. Barry Rosenthal is joining us from technical services at Betco, a specialty chemical and equipment manufacturer. And Sid Likes is joining us from OpenWorks as well. He is our divisional operations director. So without further delay, I will hand this off to Liz, who will take it from here and tell you about what we'll be discussing today.
Great, and thank you, Lee, and thanks to all of you for joining today. First, on behalf of the entire OpenWorks team, I hope that you and your families are staying healthy and safe during this time. We are really grateful and proud to have the opportunity to assist many companies like yourselves across the country with services that enable businesses to continue to operate with reduced risk and also to prepare for reopening. Our agenda today, our goal for today, is to share knowledge and expertise to support your decisions with respect to your own health and safety, the health and safety of your family, your customers, and your employees. Our specific topics today are COVID in the workplace, cleaning, disinfecting, and sanitizing, what are the differences, and preparing your facility to reopen. We'll close out with market trends and insights regarding consumers as well as other companies like yourself. To help set the stage for cleaning and disinfecting your facility and preparing for reopening or continued service with reduced risk, it's important to kind of hone in on some of the basic facts that we know related to coronavirus or around the health and safety of your environment. So a few things that we know, the virus, the novel coronavirus, is what has caused what we now know as severe acute respiratory coronavirus, or SARS-CoV-2. We also know that COVID can be transmitted through the air, unlike other viruses, or by touching contaminated surfaces, like many other bacteria and viruses. And at the early stages of the COVID outbreak, what has been learned and why the outbreak has been so significant includes around the transmission times. As compared to the flu, where on average, the average person will transmit the virus to 1.4 people, coronavirus can spread more rapidly, nearly up to 2 times or more, with an average spread of 2 to 3 people per person. And so what we're dealing with is not only a virus that can be transmitted through the air, not just through droplets that from coughing or sneezing, but also through air, and it rapidly spreads. Other things that we know is that the Center for Disease Control, the National Institute of Health, and a joint study with UCLA and Princeton found that the germs can spread, are detectable on some surfaces for as long as 3 days. We know that COVID on plastic can last 1 to 3 days, stainless steel 1 to 3 days, 24 hours for cardboard, and 3 hours in aerosol form. So it's also a pretty resilient and long-lasting virus. The flu virus can live up to surfaces for 48 hours, and other viruses can remain on hard surfaces for up to a week. And what you'll see as we address the topics for today, a heavy emphasis certainly around coronavirus, but certainly a broader set of processes and approaches to keeping your environments healthy and safe on a regular basis. What we also know is that the CDC has made recommendations to protect yourself and your environment. And we all have a very important role to limit the spread of the disease on a personal level. And here's the things that they're recommending, not only for us and our families, but certainly what the expectations around what our employees can do to help protect themselves and certainly your environment. And of course, you've heard a lot about washing your hands, which is not terribly new news. However, the guidance and recommendations are to wash hands often for at least 20 seconds. And I don't know about you, but since my awareness is raised, 20 seconds is a lot longer than what I used to do in the past. Where soap and water is not available, hand sanitizer that contains at least 60% alcohol will do the trick. But it's important that we cover all surfaces of our hands, rub them together until they feel dry. So a real comprehensive coverage. We also know that avoiding close contact is key to minimizing the spread of the virus and other viruses and bacteria. And specifically in this case, we have been encouraged to stay home as much as possible and limit interaction and put distance between ourselves and other people. That 6 feet of distance has been determined to be the distance to limit the transmission via airborne. And again, that's different than other viruses that we've encountered, which might transmit specifically through droplets from coughing and sneezing or through surfaces. So that 6 feet of distance is critical. And certainly we are encouraged not to be around those that are at risk or already have or may have the virus. Covering our nose and mouth is critical, and these are key entry points for the virus. The CDC is recommending for everyone to wear cloth protection. And this is an important point that the CDC is recommending cloth protection. Doesn't necessarily have to be a surgical mask, but for 2 primary reasons. The first reason is to prevent ourselves from transmitting the disease that we may unknowingly have or be able to transmit. And secondly, if you've been wearing a mask yourself, you know it prevents you from touching your nose and mouth. And once again, since my awareness is raised, I didn't realize how many times I tend to touch my nose or mouth, but you certainly do when you're wearing that face covering. So it's meant to protect us from passing the disease, and it's certainly meant to protect us from ourselves. And it helps, obviously, to avoid touching your eyes as well. Certainly, covering our nose and mouth, our coughs and sneezes, doing so with tissue, doing so with the inside of our elbow, staying away from the hands and a frequent area of transmission. And certainly in those cases, throwing those things in the trash and washing our hands per the protocols after coughing or sneezing. And lastly, and we'll spend a lot of time today talking about cleaning and disinfecting. And this is a proactive measure we can do in our offices and organizations and facilities, but certainly at home. We'll go through the specifics around disinfection and the best practices specific to that. But certainly when you think about cleaning surfaces first before disinfecting and using the appropriate products that are EPA registered to ensure thorough disinfection. So I'd like to pass the reins over now to Barry, who will go into more detail around cleaning and disinfecting.
Thank you, Liz. Hello, everyone. So prior to the kind of world that we're in, we would think more about cleaning for appearance. Someone would say, hey, we have a dirty restroom that needs to be clean. We have a dirty kitchen. Can you clean it up? It doesn't look good. It's not appetizing to eat there. But now we're going to be talking about cleaning for health, and in this case, critical health. We want to make sure we are doing the best practices to be in line with the CDC, state and local governments, to mitigate the potential spread of disease as the country continues to open up and more businesses continue to open up. So what we're going to be looking for is really defining what the difference is between cleaning, sanitizing, and disinfectants. And they're not all the same. And we'll spend a lot of time here with disinfecting, but we're looking at, these are different levels of cleaning or sanitizing the facility in order to mitigate or stop the spread of disease. So the first thing we're doing is cleaning, right? Everybody knows what cleaning. We use a soap or detergent to remove the dirt. It doesn't kill anything. It's not validated, but we're physically removing particles and probably removing about 99% of the soils. It is not, the cleaners do not have to be, they're not regulated. They're not tested by the EPA. There's no sort of claims that we can make that we're removing specific bacteria or viruses, but it's just a physical action using a soap or detergent in order to clean the surface. The next step we go into is sanitizing. Now, sanitizing takes the cleaning level up a bit. It reduces the bacteria by at least 99.9%. There are specific bacteria that are tested and removed during this process. Think of it as removing the bacteria to a level considered safe by public health standards. We have both food contact and non-food contact sanitizers. And because we are making claims, these are regulated by the EPA. So they have to be made in an EPA established facility, and they have specific EPA registrations that are approved, and those numbers are on the label. But the most important thing that we're going to talk about here is disinfecting. So disinfecting takes that level up. So now we're at 99.999% of specific bacteria, in this case viruses with the COVID-19. Uses chemicals to kills the germs on surfaces and objects. Basically, the way a disinfectant works is the chemical attaches to the cell surface, disrupts the cellular activity of the germ, destroying the germ and its potential spread. Now, dwell time is really important. You have to look at the label, specifically here, under the EPA list N, there's certain guidance for how long the disinfectant has to remain on the surface. The application has to be such that the product remains wet for that amount of time that's on the label. So when we think about the different application methods, we have to make sure that surface remains wet for the desired contact time. They're applied to different surfaces, floors, walls, all hard, non-porous surfaces. So floors, walls, toilets, frequently touched areas. We gotta concentrate on the high touch point areas, like sinks and shower handles, doors, desks, anywhere where people are frequently touching. These are the areas we want to make sure that we're concentrating our disinfecting efforts on. These are also regulated by the EPA. You need to use the product in accordance with the EPA approved label. And doing that, again, concentrating on the high touch points and using the appropriate disinfectants that have claims against the SARS-CoV-2. This is what we want to focus on. And so that's a quick overview of the cleaners versus sanitizers and disinfectants. And now I'm going to transition to Sid, who's going to cover how to ensure your facility is disinfected and prepared for reopening. Thank you.
Thanks, Barry. All right. Good morning, everybody. So, as I'm sure some of us are really anxious to get back to some sort of normality and get back to work and get our facilities open again, you know, whether that's fully open or in some sort of limited capacity, we want to ensure that we are cleaning and disinfecting the facility properly. So whatever your situation is, you want to make sure that you're taking the proper steps to ensure the health and safety of your employees and your customers. So one of the ways that we do that is we need to have some great processes and procedures in place. And so what I'd like to talk about real quick is some recommendations as per the CDC guidelines that we generally follow when we go into a facility. So The first one is disinfecting requirements. So these are just a list of certain things that you absolutely have to think about and have to have in your toolkit in order to open up again. So when you're preparing to open your facility, you want to ensure that your commercial cleaning company is cleaning and disinfecting the entire facility. And that basically just ensures that you're keeping your employees healthy, your customers healthy, keeping everyone happy. And they need to adhere to some very specific standards. So I'm going to cover those for you real quick. So as you can see on the list, one of those is PPE. So if no one here is familiar with what PPE stands for, it's personal protective equipment. And basically that's masks, gloves, eye protection. It could be bunny suits. It could be actually in some cases respirators. It's anything that ensures that the person who's doing the work is protected from the chemical or actually from any contaminants that are in the area. It makes sure that person is protected. It also protects the environment from the person actually doing the cleaning. So personal protective equipment is extremely important. The second is you want to make sure that everybody is trained and adheres proper protocol, use protocol when using certain chemicals and equipment, whether that be rags or mops, buckets, disinfectants, general cleaners. You want to make sure that everybody is properly trained and knows what they're doing with it. And then the third is that your particular service provider is certified by the Global Biorisk Advisory Council, so which is also the GBAC. And you want to make sure that they are certified at antimicrobial disinfectant procedures for COVID-19. So one of the things we want to talk about real quick here is the common high-touch surfaces. So this is any surface that generally, I mean, it's right there in the name. It's what gets used the most, what gets touched the most. So just take a moment and take a look at some of the things on this list and see if any of those surprise you. So you want to make sure that your service provider is disinfecting these surfaces daily, if not multiple times a day. Okay, if they're not doing that, they're endangering you, they're endangering your employees, they're endangering your customers. And so just real quick on that list, some of the things, if you just want to think about just in your office alone, your copy machine, door handles, light switches, vending machines. That's a really, really good one. A lot of people don't think about the vending machine buttons and the door that you push there. Then you have remote controls, recreational equipment, wheelchairs, walkers, things like that that are highly touched, that are kind of out of sight. You never really think about them, but they do get touched by multiple people, and they're generally neglected. So you want to make sure that those are disinfected. So let's talk real quick about disinfecting and deep cleaning and what the difference is. So if you're planning to reopen your facility after this temporary closure from the pandemic, or you want to ensure that you're meeting the CDC requirements, you're going to need to disinfect and deep clean your facility. That's extremely important. So what are the differences between deep cleaning and just cleaning? So a general cleaning basically consists of your regular cleaning tasks that most of you are familiar with. So sweeping, vacuuming, mopping, dusting, etc. Just your regular janitorial day-to-day tasks that are generally done. That's cleaning. During a deep clean or disinfecting, the service provider should be using what we like to kind of adhere to a two-step process in deep cleaning, and I'll go through those really quick here. So the first step is you want to do kind of a general cleaning of the area. You want to remove the soil, you want to remove the dirt, you want to get rid of the dust, any organic material. And what this does is Barry talked about, you're using a detergent, and you're in that process, you're knocking down most of the germs. You're not nowhere near 100%, but you're kind of preparing the area for cleaning. So you're getting rid of a pretty fair amount of the load there. The second step is that you want to use a list in EPA approved antimicrobial disinfectant. This is going to destroy all of the germs. This is going to take care of all of the viruses, at least 99.99999% of all of the viral infections, any type of bacteria, any of that material is going to be handled with a disinfectant. So that's extremely important to remember that. So let me talk real quick about, let's say you actually had someone in your facility who was exposed to the coronavirus or any other virus for that matter. There's 6 steps that we adhere to that are approved by the CDC that we follow in dealing with that. So I'm going to just briefly go over those 6 steps just quickly, just so that you understand that this is what your service provider should be providing you, preparing you to use to take care of your facility. So the first one is you want to do an incident site risk assessment. So that's basically just kind of a quality control. It's your plan. It's making sure that you gather all the critical data, you identify the hazards, the risks, everything associated with taking on this task. And I mean, and that could literally be, let's say, identifying ground zero, identifying the desk of the person who was actually infected, or any high touch areas that this person went through. You're going to want to identify those in this first step. So you're basically doing a site assessment, and this lets you know what you're going to need to do the job. When you do this site assessment, you're going to want to be in full PPE, because once again, you have no idea where you are, what you're doing, what you're coming in contact with. So you want to be fully prepared. You want to fully protect yourself when identifying where the actual, as we like to call it, ground zero is. So the second step is you want to do a pre-disinfecting. Now, that's exactly what it says. Basically, you're going to go through and you're going to remove all of the visible contaminants, all the dirt, filth. If it's an actual biohazard, you're talking about vomit or blood or bodily fluids, you're going to pre-disinfect. You're going to use a disinfectant. You're going to apply it and let that sit. It's kind of going to break everything down. It's going to knock the infectious agent down a bit. It's by no means going to get you to 100%, but it's kind of a good first step. It kind of loosens everything up and gets you ready for step 3. The step 3 is load reduction, and that's basically the physical removal of anything, of any biological material or contaminant. So load reduction is the removal and the proper disposal of any gross biocontaminated material. So that could be the garbage, that could be that waste that you removed in step 2. That could also be, for instance, your ductwork, your vents, that's been, collecting that viral material for however many days that this place has been infected. So you're going to want to remove those vents, the garbage, anything that's kind of been in the area that that could have a potential to, after you've done the disinfecting, still transmit the virus. So you want to make sure that's removed. The fourth is forensic cleaning. Okay, and so basically, sounds really cool. It's just removing the biological contaminants. It's getting everything out of the place, and you're basically you're almost at the very, very bare bones of disinfecting. You're just about there. And there's a 2-step process to that. So the first is basically a meticulous cleaning of those surfaces, and that's both vertical and horizontal. That includes the walls, that includes the doors, windowsills, everything flat and everything up. You're basically going in and you are disinfecting. You're going to knock that agent down. You're going to use a microfiber towel, which is what we prefer. Some cases, some sites prefer to use paper towels. There is really no bad answer to that. Paper towels are completely disposable. You don't have to worry about cross-contamination. You don't have to worry about whether or not that microfiber towel was used to do something earlier and the potential of cross-contamination exists. So paper towels are acceptable as well. And then step 2, you're going to basically use a detergent and go through and manually clean the surface again. And this is not a disinfectant. This is just a detergent. Any soap, any base that goes down and basically loosens up that microbial material again. So then step 5 is where we get to the most important step, the meat and potatoes of the system here, and that is the professional disinfecting. So this is extremely important. You want to use approved disinfectants from the EPA list in, and I believe we have additional information about that or where to get that. You basically can just go to the EPA and just type in list and it'll show you everything. If you have a chemical that you want to use, it'll let you know if it's approved. It'll give you the kill rate. It'll give you everything you need to know, about that chemical. So this is highly recommended. Generally, this step uses some sort of piece of equipment or some way to apply this particular material. So that's either an electrostatic fogger, a mister, electrostatic sprayer. It could even be, a guy with a squirt bottle with a disinfectant. He's basically squirting it, letting it sit, and wiping it down. So this is just the applying the disinfectant directly to the area and basically doing the final once over. And then number 6 is your post-assessment. So you want to make sure you've accomplished everything you set out to accomplish. So you're going to visually inspect it. You're going to confirm that the scope is done. Everything has been taken care of. Nothing's left behind. You didn't miss any services, and you basically took care of everything you needed to take care of. And with that being said, I think I'm going to turn it back over to Liz.
Yes, thanks.
Here we go.
All right. So a lot of great questions coming in around what do I need to do in terms of frequency or various size rooms that I have, questions around products, technologies, and what do I really need for my facility? And we're going to get to your questions in just a few short minutes. But as you think about preparing your facility to reopen or for continuing your operations, one of the things you're probably thinking about is what are the expectations of those that will be in my facility? And that is going to certainly shape the requirements that we all have as employers and for ourselves as we decide where we go, what commerce we're going to conduct going forward, and on how we're going to do that. So what we're going to share with you now are some of the studies that we've conducted to get a sense of the perspective and sentiment of consumers, of employees, and certainly with companies like yourself that may include your competitors. So let's move to the next slide. And specifically around employee and customer sentiment and expectations, we asked consumers how frequently they feel their workplace should be cleaned. And 73% said that they felt the environment ought to be cleaned daily. Well, we've been talking a lot about cleaning versus disinfection, and so we wanted to know how do they think about disinfection? And what you can see is that 56% of respondents wanted their workplace disinfected daily. And just like all of us getting more up to speed between the distinctions between disinfection and cleaning, consumers are certainly becoming much more savvy. There's a lot of information out there. And so more and more we see that, that awareness of the importance of disinfection coming through in their expectations. What do they think about in terms of the products? Well, 68% feel the use of EPA-approved disinfectants is important. Again, there's a lot of guidance out there and information that is reinforcing the need for this. And what's important, as we talked about EPA-approved disinfectants, is that essentially that list is a validation of a company's product around its intended use and claims. Because the coronavirus is so new, there is no product on the market that is approved specifically to eliminate the coronavirus. However, this is the best list of products that are approved for killing many other organisms and viruses that are out there. And lastly, we asked employees and customers how often they feel the high-touch surfaces should be disinfected. 61% said frequently. And this is really the question here, is what is frequent per your environment? If you are having consumers come in and out on a regular basis, touching door handles, touching chairs, frequency is going to look very differently than if you have them spaced out. A lot of it will depend on what is the flow of traffic. So frequent will be just determined by you. We have some customers that frequency means with every consumer moving in and out of the facility. And they are hiring day staff that we provide that are literally disinfecting high touch point areas after every consumer enters and departs, or on an hourly basis. So again, frequency is going to be determined by what you believe your specific and customers and employees will expect. But certainly, the notion is that there is a high expectation for frequent disinfection. All right, so what do other companies or competitors, what are their expectations in terms of what cleaning and disinfecting looks like going forward? And we asked companies like yourselves, how likely are they to increase the frequency of cleaning? 83% said they are likely to increase the frequency of cleaning. Interestingly, though, 94% plan to add regular disinfection to their cleaning program. And again, regular is in the eye of the beholder. All of your organizations have a differing level of need in terms of what regular will mean. 88% say frequent disinfection of high touch surface areas is important to them. Again, these are the high transmission points, not only for COVID, but any other types of bacteria or virus. Nearly 80% say the use of EPA approved disinfectants is important. Again, this is the only approved list of products whose claims have been affirmed by the EPA. And lastly, 65% expect their service providers to be certified in disinfection. Again, this industry has certainly has a different level of expectation. No longer is it sufficient to clean and certify with limited knowledge of what really will disinfect your environment. And so companies are looking for additional validation that the providers that are entering and performing the work have a degree of technical expertise to be performing that work. All right, so certainly to kind of wrap up here, we'll just share that, of course, with these requirements in mind, OpenWorks has a list of services, our TotalWorks complete cleaning and disinfection service portfolio that is really designed to meet the various needs and expectations that you have, that your customers' employees will have. What you see here is our recurring services suite, varying in terms of the frequency by which disinfection occurs, and certainly levels of supporting levels of frequency, as well as signage and certification that an environment has been clean and disinfected. In addition, as Sid mentioned as well, we have some specific one-time services. InfectiGuard, which is your deep clean that will clean every nook and cranny, every vertical and horizontal surface, will be disinfected. And InfectiGuard, which is delivered specifically for environments with a confirmed case of COVID or some other type of biohazard. And again, in that case, we are following a specific process by the Global Biorisk Advisory Council to ensure not only is the biohazard eradicated, but that also the individuals performing the work are not introducing new hazards into the environment. So with that in mind, we'll just certainly wrap up the formal presentation. OpenWorks is a nationwide provider. We've been in business for over 35 years delivering complete facilities care. We have an elite group of service providers to perform this work that are certified to do the kind of work that can ensure healthy and safe environments. We believe our 98% customer retention rate is great evidence that we perform that well on a regular basis. We do use EPA list approved disinfectants. That is a requirement to deliver our service. We are OSHA bloodborne pathogens certified and also GBAC certified as well. So with that in mind, we want to let you know that to answer your questions, we'll enter the Q&A. We do have resources available. You can reach us at info@openworks.web.com if you're looking for more information or interested in engaging around our services. We have a downloadable executive report that you can share with those in your organization as well, covering some of these topics. And then we also have coronavirus prevention updates that we will keep regularly updated and accessible to you. So let's transition now in the time we have. There was a number of questions related to equipment. And Sid, I wondered if you could share a bit about the types of equipment available: foggers, sprayers, electrostatic disinfecting sprayers, maybe some of the distinctions, and really what do companies need to look for? What are the key criteria for selecting the right equipment and utilizing it correctly?
Absolutely. So I believe the question was what would be a good resource and what are some of the differences. So let me just, without getting too micro about this, that you have electrostatic. That's a word that you guys probably hear a lot. So electrostatic, what that does is it basically will take a particular chemical and break it down to a particulate, and it will completely encapsulate a surface. It'll go into the nooks and crannies. For instance, think about, let's choose a keyboard, so on your laptop or a computer. So it will basically go in and go in between the keys and get it to all those little spaces that you couldn't reach with a towel. It'll go in there and it'll basically surround the virus and it'll kill it. So it's able to go underneath, and because it's electrostatic, it will stick to that surface. So there's no, if you just sprayed it with a regular sprayer or mister, that's a liquid substance which is subject to, it'll run, it'll drip, it will evaporate, but electrostatic will actually go on and it will stick. Whatever it touches, where it lands is where it lands. So, and then moving down that line, you have a fogger. Now, a fogger basically is exactly what it sounds like. It's a piece of equipment that's typically handheld, and what it does is it takes that chemical, takes that particulate, and it kind of does exactly like a, I guess for lack of a better term, a flea bomb or a pest control. It basically creates a cloud or a mist. It completely covers the room, and it gets over everything. Now, if something is covering that particular, like let's say there's a giant file cabinet blocking a wall, well, the fogger's not going to get behind that file cabinet. It's not going to go around anything. It's not going to go underneath anything unless it's positioned under it or unless it's manually placed there. But a fogger is pretty effective. They do require the person who's operating needs to be in full PPE and full respiratory equipment. This is pretty dangerous stuff if inhaled. So for about 2 hours, you want to basically clear everyone out of the room to do that, but it is extremely effective. I think the second or the third line would be a mister. So a mister is basically exactly what it sounds like. It basically goes on wet, and it just, wherever you spray it is where it goes. So it's usually, you can be done with an airless sprayer, which is just kind of almost a paint gun. It basically just applies just a dousing of the chemical, and then that chemical sits and basically evaporates, and as it sits there, it basically kills and then it evaporates. There's no need to wipe anything down. It just sits there, kills everything, and then evaporates. It's gone, and it's safe to put your equipment back on it. With a mister, I have to stress this, they are not recommended. If you've got exposed electronics, or if you've got something that is recommended that you don't get it wet, although you're not saturating the area, you are applying something wet to something electronic, and in typical scenarios, electronics don't like things that are wet. I think as far as good resources to get that equipment, right now, as you guys can probably imagine, they're in high demand. There are huge back orders for these pieces of equipment. I think I read something yesterday where United Airlines has about 750 that they've just purchased. and are deploying on their airplanes. So these things, everybody wants them. So they're hard to get, but if Barry, you're still here, I think Barry would probably be able to speak to the best resources in order to kind of pick one up in throughout the country.
Actually, I wish I had a source. No.
sorry, Barry, I didn't mean to put you on the spot. So even our supplier, our expert here, he doesn't know how to get them. So you basically, just to answer that question, is you just kind of want to keep an eye. If you have a janitorial supplier or Amazon, I've seen some advertised on Amazon, but they're going for buku bucks just because people know what they have. Just keep an eye as supplies start to enter the market, and as we start to get a little bit more comfortable and the supply demand kind of goes down, you'll start to see them. They're generally an electrostatic sprayer will cost you anywhere from $700 to $1,000. A fogger can cost anywhere from $200 to $500, and then a mister or a more expensive fogger could run you up to $3,000. So hope that answered your question.
Thank you, Sid. So with that in mind, there are a lot of questions you asked, certainly around cleaning a variety of surfaces such as fabrics, specifics around disinfectants, their dwell times, and what to use. And we won't have time today to answer all of those. However, we will take all of your questions, respond to those via an FAQ, and send those to you. In the meantime, if you're looking again for support or have questions, you can reach out to us on the email address that was listed earlier. So with that in mind, I want to thank everyone for your time today, your attendance, your great questions. We appreciate that. We certainly are here to serve you and help to keep you and your organizations and environment safe. So please let us know how we can help. Otherwise, you all have a great day, and we wish you all health, that you are all healthy, safe, and to be well. Thank you very much.